The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of BoBo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Keeping you up to date with information you can use. BoBo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Want to thank you for tuning in today. It's Healthcare Today with HSA. We have another exciting episode. I'm your host, Chuck Taylor, and today we have a wonderful representative. She is the head of general practice over at HSA, Dr. Eryka Simmons.
Correct. Good afternoon, Chuck. Good afternoon, audience.
Good afternoon. Wow. So just dive right into it. Tell me a little bit about yourself.
Oh, boy, you're putting me on the spot.
Well, all good things happen to be on the spot.
A little bit about myself. General practitioner, love all things medicine, love food, love my community, love just sitting down and having a good conversation with anyone, which is why I think we're here today for you and I to talk more about HSA and our new and exciting venture.
Nice. And that I think that's part of the joy of it is exactly what you say, the love of community, the love of health, and blending the two of them together. I think that opens up so much more from a community standpoint. So how long have you been head over the GP?
Been head now since 2015.
Okay, excellent. Oh, so you're an old hand at this, as they say. You know where all the doors lead in the building, because when you walk in there, you be like, okay, this door doesn't have any. You know where all the doors lead.
Definitely, yes. I've been with the HSA since 2010 when I came back home. So it's been an exciting time with them.
Nice. So I know you guys are always doing major things. Lead me up to where we are today with the HSA because as GP, and sorry folks, I use the acronym GP General Practice because she knows. So as the head of that, there's so many moving parts. Just give me a little bit of some of it.
I'll give you a little snippet.
Yes, ma'am.
Well, earlier this month, we announced the opening of the new Georgetown General Practice Clinic and Public Health Clinics. They're now relocated from the hospital to now the Smith Road Medical Center on the second floor. So it's a major initiative that we did. We've been working for this for a while, and we're very happy that this move has finally happened. And it was centered on improving the quality and the accessibility to care for our patients by the HSA. This opening happened on the 11th of April.
Okay, so brand new location, but same great service and same great idea, but just expanded.
Definitely. Same great service, I dare say even better.
Nice. So it's over on Smith Road. This is the new what we call the medical center right there at the corner by the SDA church right there when you're turning in towards the I guess the I'm trying to remember the road. Oh gosh.
So it's literally it's on Smith Road. So just after you've come off of Bobby Thompson, if you're coming from that way, or if you're coming from the hospital direction and going towards the airport, you'll see the 3-story building on your right.
Exactly. And so that's what I'm saying. When you, because we all know where the HSA is, and then I know the Estate Church, and then you have the other little building, and you're the right or by the roundabout.
Just after the roundabout.
Right, the
so you'll
3-story.
pass Dr. Fuller's office.
Right.
And then you'll get
And then you get there. See, folks, when you go down by the tree and you make the right turn and you see the almond tree and then you come across the breadfruit tree, you know exactly.
Can't get no more Caymanian than that.
Exactly.
Right?
When you be like, oh, that roundabout and it's a 3-story building right there. That's where we're located at. And I say we because I feel like I'm becoming a part of your family, you know, being here each and every weekend. Folks, don't forget you can tune into us each and every Friday and also Saturday. We give you all of the information. It's a repeat broadcast on the Saturday. But I have to tell you, part of the enjoyment is knowing what you guys and girls do for the health authority right here in Cayman. And I've seen a lot of organizations in my time, and this is so world class. This is the creme de la creme, and you help so many people.
We do. We see babies right on up to our seniors. So they're all encompassed under general practice and public health.
Exactly. So the GP office, and the main hospital campus, what time do they open and close?
On the main hospital campus, we're not there anymore.
Yeah, I mean, they close on Saturday. Was it April 9th, I think?
Yeah, so sorry, but when did we close? We closed on the 9th. So we closed the GP clinic and we closed the flu clinic.
Okay.
On that same day.
Uh-huh.
So that then on the Monday, the 11th of April, we started the new opening of the general practice clinic, the public health clinic, but also our urgent care walk-in clinic.
Okay, so the urgent care walk-in clinic, they're open Monday to Friday, 8 a.m.
to 11 p.m. We have extended hours now.
Wow.
And on Saturdays from 8:30 to 1. But the urgent care clinic is still on the hospital campus, so that remained.
That remained on the hospital campus, but the GP clinic is now located at the Smith Road Medical Center. And you guys at the Smith Road Medical Center are open from Monday to Friday, 8 a.m. till 8 p.m., is it?
That's correct.
So, folks, they make the extended hours and the extended hours because, I mean, a lot of times things happen after 5 p.m., 6 p.m., and you do need to get to a qualified healthcare professional. And the hours that you have just stated here is very, I mean, of course, we know the HSA is open 24 hours, but for these types of immediate urgency things, it's quick to know where you can go to seek medical help. So tell me a little bit about, in your role, the Phlebotomy Lab. And people be like, how do you know these words? I do my homework, folks.
Yes, you're well versed.
Yes.
So, also exciting, phlebotomy also has a branch at the Smith Road Medical Center. So they're also there. So once you've seen the doctor, and if they want to do blood work, you no longer have to go to the main campus. Phlebotomy services are available. You can get your blood work done at the clinic. And
so, folks, that just means that now you have an easier location because sometimes it gets congested, it gets busy.
Yes.
And also, it's more convenient. It's
and
a bigger space.
HSA is really intent on making sure that our patients have the best experience as possible. So you can get your blood work done at any of the district clinics, but since the Georgetown clinic has now moved, we have taken phlebotomy with us. So the patient has a lot more options, more parking options. So that does give them a better experience.
Exactly. So I wanted to ask you, and this is just reverting back, this has been in the works for quite some time.
This has been our baby for a few years now, just to get it planned, as we know the population is growing. So the move was always just not to make a move for now, but a move that encompasses this population growth and for later, so that we can expand. So it's been going for a few years, and we're just so excited to see it come to fruition.
Once again, folks, we're talking healthcare today with HSA, talking with Dr. Eryka. She's the head of a GP over at the HSA. And speaking of GP clinic now is only for appointments?
Well, all of the district clinics have been by appointments. Before, the Georgetown GP clinic offered both a walk-in service and an appointment service. But now that we've officially split, and by split I mean We have the urgent care walk-in services on the main hospital compound, and then the GP relocation over at Smith Road Medical Center, that's by appointment only.
Okay, so but if I say suddenly get ill and I need to see a doctor, what would be the best course of action for that?
If you suddenly get ill and it's something that you need to be seen for today, then I really would suggest you visit our urgent care walk-in clinic. Those are for acute issues, something that needs to be seen now urgently, not an emergency, because we're not trying to crowd the emergency department. We want to make sure that the true emergencies can get there, get seen, and not necessarily get overshadowed by a person who has a less severe case, who could have been seen at urgent care, or sometimes even at the GP clinic.
Right. And hence the name walk-in clinic.
Yes.
If you're able to walk in, then you should go to that type of clinic versus the emergency, which we know, requires a lot more time and a higher level of expectancy also.
Definitely. But let's say you wake up and you have flu-like symptoms, or you're having pain in your ear, you were playing sports, you have a fall, all of those things, sprains, minor falls, they can all be seen over at the urgent care walk-in clinic.
Okay, nice. And their services are open from what time?
Services for the urgent care are Monday to Friday, 8 a.m. to 11 p.m. And on Saturdays, 8:30 to 1.
Nice. And this is over at the atrium at the main hospital campus.
Right. Yes.
And see, I can say the word atrium. Folks, if you don't know, when we're young, that's the area that you sit down in the front and you get the cool breeze. We came on you. We understand these. And the good thing about this, folks, is that this is immediate taken care of walk-in clinic. So it's not by appointment. You can just go there during any one of these times when you have as she said, an acute symptoms that you need to be looked at immediately. And the flu clinic, I know you guys closed that earlier, but you moved that now. So if there are flu type symptoms, they should still check in with urgent care.
With the urgent care, definitely.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Keeping you up to date with information you can use. BoBo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA. Now back to Healthcare Today with HSA and our host, Chuck Taylor.
I want to thank you for tuning in today. It's Healthcare Today with HSA. I'm your host, Chuck Taylor, and today we have a wonderful representative. She is the head of general practice over at HSA, Dr. Eryka. And once again, folks, if you're requiring blood work after by the doctor, say, hey, we don't need it today, but you need to get blood work done.
How do options now? So your only recourse is no longer just to go to the main hospital. You can go to the Smith Road Medical Center on the second floor where GP is located, and you can also access phlebotomy there, just as well as you could access it at any of your district health centers.
So it's still available in all the districts. And you guys have so much. You say district, but I grew up calling them outpatient, because they're like the out. But they're district clinics, and it's in every district, even in Cayman Brac.
Exactly.
And this just means that, folks, suppose if we're in the West, you don't need to get all the way to town because you have options to go to there also.
Exactly. So you would go to the location that's more convenient to you. And that's a big thing for patients. They might not be able to leave where they're living or where they're working or vice versa. So you have options for where you want to go and get your medical attention.
once again, folks, they're making it so simple and so easy for you to be able to get the level of health care and also service that you need. Because once again, we're talking, there's so many moving parts here.
A lot of moving parts. A lot goes on in primary health care, and primary health care encompasses all of the outpatient clinics, like what we were saying, the district clinics, but also public health. So all of the immunization clinics, the clinics for the newborns, everything is all going on at the same time.
Under one roof.
Yes, under multiple roofs. There's roofs across all the districts. We're offering all these services, and then we have the specialists that also come in to the district clinics to do these services. Like the pediatric clinics will be held, physiotherapy will be held, nutrition will be held. So what we're trying to do is be able to offer a little bit of these services at every clinic so that patients have options. And I think in this day and age, options are excellent.
Right. Because once again, you have to think of it this way. The more, and it's all, as you said, all under one roof, but it's very individualized care. It's very personal care. And that's what people are looking for.
They are. And Caribbean people, once they get to a spot with a physician, that becomes their doctor, and they will follow them to wherever they go. But you'll get that exceptional care at any of the clinics. All of our physicians, all of our clinical staff, they're there for you. So even though you might have a preference with another doctor and you might not be able to get to your doctor on the day you'd like to, any of our other staff will happily take care of you.
And that's always good to know that no matter which location you're at, the level is always professional. It's always on that. So there's a comfortability factor also with that.
Totally.
So as we keep talking, one of the thoughts that popped into my mind is we're an island that loves to travel. We kind of see the world changing over the last few years. And now everybody is about vaccination, but before, I think if you had to go to Africa, you had to get 6 or 7 shots, but the rest of the world didn't care about, flus and these types of things. Tell us what the HSA offers in that department.
For the public health clinic, most persons, when they hear that, they just think of when the babies need to get their vaccinations. But that also includes when the adults, like you were saying, or anyone else has to travel to destinations that you may want some more coverage for your health, or for that destination, they require that you have it on board. For example, when you go to Trinidad, you need to have your yellow fever. As you were saying, when you go to Africa, there's a slew of vaccines that you should also have on board.
Right.
So we have our adult and travel health immunization clinics. They're done every Thursday, also by appointment. You can call 244-2648 to make an appointment. And the nurses there are excellent, and they can walk you through what you need, what you don't need, how soon in advance you should get them and everything. And then they'll give you your records like they would your immunization records.
Yeah, so if you're traveling and you go to the visa your destination, your visa office, and they say, oh, you have to have XYZ shots, you can actually bring in the paperwork, show them, and they can, or call them and they can make appointments and go from there.
And then not only for travel, we've been overshadowed by COVID for the past 2 years, like you said, but there are also some other age-related vaccinations that are important, like the pneumococcal vaccine. So vaccines for pneumonia, which can be quite harmful to our older population, or population with other illnesses. So the nurses offer all of those as well.
That's interesting that you say it like that, because one of the things you think of is, oh, I only need my flu shots, but it goes beyond that. There's a whole slew of things that you need to be aware of, such as...
Definitely. Chuck, you're right. So when you discuss with your doctor, depending on how old the patient is, but there's the pneumonia vaccine, which is, is quite detrimental and harmful to a lot of our elderly and persons with other illnesses. But then we also have to think of our kids. We have to make sure their meningitis vaccines are on board. HPV is also important. Children now are routinely getting the chickenpox vaccines.
Right.
But there are some kids who might not have gotten it. So, all of these things need to be sat down, because if you can avoid getting them, especially go ahead and get your vaccination.
Right, shingles, the list goes on and on and on. And once again, folks, you don't think of it till you have it.
Yes.
And then it's irritating, it's uncomfortable. It may even lead to death. So you have to be aware of them beforehand and keep up to date with them.
Shingles especially, that's the one it just comes out of nowhere for persons who've had the chickenpox vaccine, the chickenpox virus. It just goes to sleep for years,
and then
not bothered. And then when the right circumstances come about, it comes out now as shingles, which can be really, really uncomfortable, like you said, harmful. In mild cases, persons can die.
Right.
But it is definitely avoidable.
Yeah, and I will tell you from a person who's on radio, you do not want these things, especially because your picture taking and selfies, they go out the you don't want to be doing that, folks. And these are conversations. I know we have a lot of teens and young parents listening to us at this time. These are things that you need to kind of take a hold of beforehand. You want to be top of mind awareness, and this is the things that you can ask the HSA, ask your doctor, call them and say, hey, how do I go about this? Even if you've never had it before, you can see about getting it done early.
We see commercials all the time on the TV, and sometimes you might wonder, is that something I should have, or do I even have it? Because I know we all have our little immunization book, but have we ever really gone through and seen what have we had? What do we need? So
half the time I don't even recognize the handwriting in there because I mean, y'all doctors, you got better with it. But at one point in time, I was like, I could be a doctor. I got bad handwriting. I was like 15, 16, and my chicken scratch was just off the chain.
I think you're being kind. Our handwriting is universal. It's still atrocious.
Still,
yes.
I'd be like, but you know what? The beauty is every doctor can read another doctor's handwriting.
Yes. It's a blessing.
I look at it and be like, Doc, I understand exactly what they wrote.
Actually, I'll tell you a little secret. Nurses read our handwriting better than we do because, they have to interpret the orders and everything. So sometimes we embarrass them. They can't make things out, and the nurse will be like, oh, that's just an order for X. And we're just like, wow.
Well,
so
exactly.
The nurses are actually the kings and queens of interpreting doctors' handwriting.
That is so, and big ups and kudos to all the nurses out there who do such a fantastic job over at HSA and worldwide. I mean, I remember when we had nurses, just kind of showing them love because they're kind of the unsung heroes in a lot of they're in every room. There's at least one or two nurses, and you don't see them, you don't hear them. But when the doc look at them and that connection, they know, okay, I need this size needle. I need to get this. It's just that unwritten code that you guys have.
Absolutely. They are our backbone. We cannot function without them.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Keeping you up to date with information you can use. BoBo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA. Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Once again, thank you so much for tuning in. We're an hour program each and every week here. We get together and talk about healthcare today with HSA. I'm your host, Chuck Taylor, along with Dr. Eryka, talking about the brand new location over there for Georgetown General Practice and Public Health Clinic. It's on the second floor at the Smith Road Medical Center. And this has been opened up from the beginning of this month, and quite a bit of services you guys offer there. outside of, I mean, I haven't been down there, but I've heard somebody who went down there. It was like, man, it was comfortable down there. So you guys spent a lot of time talking to patients, figuring out what was needed there.
That definitely, and you just try to pick up on things that you see are absent. So the building was purpose designed so that you could have a better patient experience, better patient flow. We would be able to accommodate more patients, and HSA does have a growing patient base, and we wanted to be able to meet that, to match that. And our architects and our facilities just went above and beyond.
Nice.
And it does help that almost everything is in that building. Downstairs on the first floor, the new outpatient pharmacy opened up. And then now GP has moved in, public health nursing has moved in, specialist was already on the third floor.
Right.
And more services are coming on the second floor. So patients are really going to have a whole different experience when coming to the HSA.
Makes it a lot smoother, a lot quicker, and that's because patients have gotten more sophisticated.
That they have.
They're requiring more comfortability, more attention. Would you say that?
Oh, definitely. I mean, it's not. Back in the day, they called it didactic, where you would just tell the patient and then they would just accept it. Now they come with their questions. Now they come with their own diagnosis because they've been on Dr. Google. So they've almost kind of leveled the playing field to say it's not just what you can tell me. You need to tell me why I need to believe this is so, and what can I do to help myself. So we're not just there just to say, here's this medication, take it. We want to tell you why you should take it. What are your options if you don't take it? What are some other measures? We want to meet you halfway so that you can take your health in hand, because if you have an investment in your health, you're going to want to have the best outcome.
Exactly.
It's not just my doctor says so. It's about...
That I think that's the thing about it. In today, people are a lot more savvy with intellectual stuff. Yeah. So before, I want to say we didn't understand, because I was in it too. I was like, I don't understand what the doctor's saying. But so you would ask one question and assume that was it, rather than, so this medication, is it side effects to it? Is my skin going to get dried? And well, if that's the case, how do I combat that? Tell me a little bit about that patient service.
Well, that's the kind of relationship you want to have with your doctor, not just your doctor. You want to be able to speak to your nurses about this or your therapist about this, that there's no silly question. There's no silly concern. It's your concern. So once we get you on board, hopefully we can address it. And at GP, at all of our district clinics, our doctors aim to be able to empower our patients as much as possible. And then we have other staff on board. We have nutritionists. So when we see you're struggling maybe with your diet, or maybe you have a new diagnosis and your diet should be taken into hand, or you have some persons who they want to gain weight for some people and they want to lose weight, then we can send you to the professionals who are also operating out of the clinics as well. So you can go to your nutritionist. We also have a diabetes education coordinator.
So there's a lot of internal referrals, is there?
There is, definitely.
And once again, I mean, as Caribbean people, we have a multitude of various health problems from family diagnosis. So some the sins of the father becomes the sins of the son. So I'm kind of concerned about high sugar and that. What can I do to combat that? Because my grandfather had it, my uncle had, those types of things. So, that's the level that we're talking about here.
Which is the basis for general practice. That falls under primary health care, which we're there to treat you, but our main aim is prevention. So if we can prevent a lot of these things, the hypertension if possible, the diabetes, all these other illnesses, it's not always something that is possible. Genetics does play a huge role, as does our diet. We're not as mobile and active as we used to be. Things have become so much easier now. We're at computers instead of walking everywhere. We drive more places than we walk. But we're there to have that relationship with you so that you can get comfortable to see that, these are the things I need to do as well. And there are a multitude of referrals for when you need them. And we want you to leave with those appointments in hand. That if you need to do physio, you can go see the physiotherapist. And there are services like acute physio, so that if you do have an injury and you need to be seen it's not that you're going to have to wait till next week. We can actually get you seen that day by the physiotherapist.
Okay.
And then get you to all of the other services.
Very instantaneous. And I think that's part of the thing that I love about Cayman and the HSA is that immediate care service. I mean, you've been to organizations in the past and, globally that, here we're stacked. You're going to call us back next week or come back in a couple of days, make an appointment. And sometimes it may be something really that is needed right away.
True. And those options are there for those that need to be seen right away. But at the same time, there are those instances where you can actually wait a week, or you should, because we need to see, is this medication working for you? Is this new therapy working for you? And you have to give the body time to do what it needs to do as well. So you have, what I would say is, a lot of good options. Having worked overseas, like you were speaking of earlier about globally, you take a lot for granted here that you do have to wait, or things might be better overseas, and actually it's not so. Cayman has excellent.
This is a world-class facility, and you could drop this island in any major market, any major city, and it performed and probably outperformed some of those that exist there.
I have no doubt.
And that's one of the things I know. I see from what has happened with the GP clinic over the course of years. There has been a constant progression towards excellence.
Demands, yes, definitely. Because it's not just the appointments. Like we said, for the GP relocation, it is by appointments only. However, that doesn't mean that if you wake up this morning, you can't call and not get an appointment. You just call the great staff at appointments. More than likely, will be able to fit you in. Maybe they might not be able to fit you in Georgetown, but you can get another appointment in one of the other district clinics if that's convenient for you.
Right.
But then we also offer evening appointments because not everyone's able to leave work to go to the doctor. Sometimes it's more convenient to do it after hours, and there is that option as well.
Right, because you stay open till 8.
Till 8, yes.
Yes, and I think that's one of the beauty that HSA has realized over the course of time is that not everything ends at 5. Yes. And they open for the odd hours, I call it, because people tend to have more time to think about things and do things after 5 p.m.
So I just like to encourage persons where they need to be seen urgently, that there is the urgent care clinic, the urgent care walk-in clinic, and this is at the HSA main campus. Again, the days and hours are Monday to Friday, 8 a.m. to 11 p.m., and Saturdays, 8:30 to 1 p.m. These are for cases where you wake up, you're not feeling well, but it's not an emergency. Okay. Emergency, we don't want to inundate their system or take away from true emergencies. We want to keep that for those critical patients. So the urgent care are for people who can walk in, or maybe you might have to hobble in if you have a little sprain or a strain, but you can all be seen at the urgent care clinic.
Right, and their times is open Monday to Friday from, what time is it again?
8 a.m. until 11 p.m.
11 p.m. And then you're open on Saturdays also?
Yes, 8:30 to 1.
Okay, so and the good thing about that is that's kind of there for anybody that immediate.
Who has an immediate need. If we're honest, sometimes there are things that can wait till tomorrow. I'm not encouraging patients to sit home with an issue, but let's say you need to have a medical done or you want to have a checkup. Those are things you can book, and by all means call our district clinics or the new GP location, and we will happily book you in and see you and get everything done. Right. But if it's something that needs to be seen today, you're not feeling well today, that's what the urgent care is for.
The pain is at that level.
The pain is at that level. If the pain is so horrible that you can't walk, then more than likely you need to go to the emergency department. But if the pain is quite terrible and you need somebody to take you to help you get in, the urgent care is there for you. But we have really good communication. We're all HSA between the emergency department and urgent care. So if it turns out that someone at emergency is actually more urgent care, they will transfer them over to us, and vice versa. If we have someone who comes in At first, it seemed like it was an urgency, but really, when we evaluate the patient, it's an emergency case.
Right.
We'll also transfer them over.
Right. And that's kind of where the professional attributes come in, because you're able to make that assessment when they're there. You're able to see, you're able to take the checkups and say, okay, you know what, we're going to move you to this way, or we're going to keep you here, and you can make that assessment at that time.
We have excellent nursing staff, but also keep in mind that sometimes you might come in for something that we've had cases of persons who come into the urgent care for a checkup. When you come to the urgent care, because it's not an appointment, it's first come, first serve. I'm not saying you're going to have a very long wait, but there always is that possibility if you have 30 people ahead of you, 20 people ahead of you. But our nursing staff, when they talk to you and see what you're there for, they might be, well, Mr. Jones, you can actually be seen over by GP. Let me call and see if there's an appointment today at 2. So rather than you sit down and wait for 2 hours, you can go do your business.
Right.
And go at 1:45 over to GP and be seen for your 2 o'clock appointment. That way you don't waste a lot of your time.
Makes sense.
So it's to do the best thing that gives you the best outcome. As humans, invariably, we like to not have to wait. So we can be seen now. We'd rather be seen now. But we do also recognize that there are times really you just needed an appointment. And that can be done over at GP. But if you wake up and you're having flu-like symptoms, you're just not feeling well, the urgent care is there for you.
And that goes back to, you guys have a great time management understanding and time management system to figure out.
We try, thank you.
You try to figure out what's the best attribute for the patient themselves. It may be something where they can say, okay, you know what, you live in North Side. You don't need to come to town to do this.
We're not going to bring you into town. We all know about the traffic issue that we have on island now. So if I can avoid patients having to get on that road just to come to town, we encourage them to get seen in your districts. The pharmacists are at your districts. Your doctors are there. Everything is there for you. We might not be open every day, but Georgetown and West Bay, the bigger clinics, they're open every day, Monday to Friday. Bordentown would be the next busiest. They're open 4 days a week. So it's just East End and North Side that we're looking at, to try to have more clinic days, but it's also based on the demand.
Right.
So, we don't want to put resources where they might not be utilized.
Exactly.
But we're also cognizant that we're trying to get persons to be as close to where they are as possible, whether it's that you're going to a clinic close to where you work or going to a clinic close to where you live. So that way the patient has the best experience possible.
And I think that's the beauty of it, that allows everyone to move forward and also just understand the sheer magnitude of what you got, the undertaking that the HSA has done. And with every machine, you guys operate on such a high level that makes it, I walk in there, I've had emergencies with family, and, it's information. Okay, you can do this, you can wait here, you can go see this doctor, he's coming in at this time. And, I've had them, I've had people in my neighborhood the elderly folks that had critical emergency. Oh, we need you, Chuck, to take, cousin so-and-so, whatever. And I get there and they're like, okay, come right in, let's take a look at so I understand the hierarchy of it, and you guys do an amazing job of seeing that beforehand. I guess after years of doing it, it kind of comes second nature. Thank
you. We appreciate that. Yeah, it's all about triage and then communication, because you have to make sure the patient feels relaxed and they know what to expect, but also just putting their mind at ease,
Exactly. Sounds very, very good. As we keep moving, folks, thank you for tuning in. This is Healthcare Today with HSA. Sitting in the hot seat, myself, Chuck Taylor, along with Dr. Eryka. She is the head of general practice over at the HSA. And so we've talked a lot about that. You said the love of of medicine. We're gonna dive into that a little bit. Get a little personal here. Kind of get to know your doctor. Tell us what sparked your interest with healthcare.
Oh boy.
I know I'm putting you on the spot, but
Definitely putting me on the spot.
But put it this way: we have a captive audience. Maybe there's a young person out there who's thinking about going into medicine. Yeah.
Medicine is so huge. I mean, the world is your oyster, as they say. I've always just been curious by nature. And I can't tell you the first thing that drew me to medicine, but I was always putting Band-Aids on my dollies, I guess you could say,
right.
trying to fix them up. So that's always been something that I've been in love with. And when I was younger, a nurse who was a family friend actually taught me how to stitch, and that was just my love of everything. So she'd show me how to cut open a doll and then how to stitch it back up.
Right.
And from then it was just like, oh boy, I could do this for a living. Not that you want someone to hurt, but just to know that you can help them in any way. But there's just so much out there for anyone who thinks they may have a curiosity about medicine. I encourage them to explore it. It's such a wide world. It could be from being a dentist to being a physiotherapist, to being a nutritionist,
right,
being a counselor. There's no part of medicine that is more important than the other. We all work together. The body is an amazing thing.
That's your leading to, don't forget, by the end of this month, you still have time for all the students to get in. Just go to HSA and you can sign up for their internship program. I thought I would just toss that in there because, you know, as we said, we have great healthcare facilitators on this island who have, you know, children of the soil, children of Cayman that have fought and basically brought their love for medicine here. And so this is one of the things I think that you guys, along with being a great world-class service, offers this amazing program. And the end of this month is the time frame. So folks, I just thought I'd toss that in there. You can go still and sign up over at hsa.ky. Getting back to the new GP and the public health clinic over on Smith Road Medical Center. I know that just a few weeks ago, the health minister, the Honorable Sabrina Turner, she and the board got together and they had the big cut ceremony, cutting and all that stuff. And then it was like the next day was business. Hey, so I saw some of the clips of it and I was like, okay, so they had the ribbon cutting and immediately they had patients at the door like, you guys don't stop working constantly.
No, not at all. Our senior management team, they always have projects on the mind, projects that they're always dealing with. So there was the cutting, the ribbon cutting, like you said, and then the next, shortly after, pharmacy opened and the patients came in and the feedback has been wonderful. So everything has been done with the patients in mind. And this is all, as we know, this island is growing, our population is exploding, and we need to be able to meet their needs. Not only meet the needs, but surpass the needs, project the needs, prevent what we hope.
Just reminding you about our nation's sister services over there at Faith Hospital in Cayman Brac. Tell me a little bit about that.
Our sister services over at Faith, they are also an excellent team run by Dr. Velasamy. They have clinics as well over on the Brac and as well on certain days over on Little Cayman because, you know, the population is a little bit different.
Right.
But they offer the same services that we do over here on Grand Cayman. They have the pharmacy services, the district clinics. They also have the home health care like what we have here when you have to go out to your home care patients, the ones who are homebound. And it's either difficult for them to come to clinic or they're unable to come to clinic because they're bedbound. And so we all have the similar services. It's on a slightly smaller scale over on the Brac and definitely markedly so on Little Cayman, but just as important and they're just as busy.
And that's one of the things, it's such a broad range of medical and specialist services that the HSA offer. And just so people can understand, it's, if I get this right, it's 9 locations throughout the 3 islands, yeah? and that includes the 4 district clinics, which would be East End, Northside, West Bay, and Bordentown.
And then
See,
now the new GP clinic.
and
yes,
now the
yes.
new GP. You see,
Enjoy,
I'm
Doing good.
taking notes. I'm crossing my I's and dotting my T's.
Definitely.
You hear folks crossing my I's and dot my, just checking. And one of the things that I love about it is the care ratio. I mean, you know, we have such a growing population, and you still feel that personal care. That you don't feel like you're just a number.
No,
when
at
you
all.
come there.
Every patient is important, and the same specialist services that we offer in Grand Cayman to see your orthopedic doctor, your pediatrician, they all visit over on the BRAC. There's a rotating schedule. So the patients on the sister islands, they do get that same level of care, same level of access.
That's nice, and just to so people can get to feel and understand that the level of care is equal across the board. Correct?
Yes, we try our best.
I love talking about the HSA because there are so many different avenues that you guys deal with, different levels and tiers of doctors and different things of that nature. You know, you was telling me that, you know, all of the levels are equal, but then there's so many different levels. Tell me a little bit about that.
Many levels. We have dozens of doctors on staff with the HSA. So many specialists. We recently had a new neurosurgeon on staff. We have chiropractor on staff. We have so many specialists. We have a world-class orthopedic team, pediatricians, everything, you name it, they're there at the HSA. And when we find we don't have a particular specialist, then we have specialists who will visit. For example, our rheumatologist will visit, and our dermatologist will also visit, and other services. We have a pulmonologist now who's going to be visiting. So HSA sees the needs, and whereas we might not be able to have that physician as a full-time person just yet, doesn't mean we're not working on it, but we do try our best to make sure that the patients can get to it. We can have that person coming to visit for us.
Okay, and I think that's the need to care, that where you see a need and it keeps building.
It does.
Maybe it may be 1 or 2 people, then over the course of time you see a need for it to take care
the need
of.
Increases, so you have to meet that demand as much as possible. For my area and the general practice service, the urgent care walk-in clinic still falls under primary health care. So between urgent care that now has a staff complement of 7 physicians and general practice, which has 13 physicians, we then service the island.
Right.
So the staff for the urgent care, they're based just at the main hospital. They don't leave, but you know, you're there from 8 a.m. until 11 p.m. It's difficult to leave. However, the general practitioners, each physician has their own focus, their own passion. So even though they see everyone, there may be someone in the team who specializes more in diabetes, another person who specializes more in hypertension, one more, myself, who has a love for dermatology. So all of us, we tend to then, you know, direct patients to each particular area so that they can be seen by that subspecialty per se. But we still see everyone once they come in.
Right.
And then I think I mentioned earlier about there's the home health care. So the doctor along with the nurses, the home care nurses, they do home visits daily between Monday to Friday to see the homebound patients for their district. Each district has a certain amount. And the patients are seen either between every 3 to 6 months, depending on their needs. If they have an acute issue, then their family member or the patient themselves will call, and then the nurse will slot them in and she'll go and see them. And then there's a physician visit once a week.
Okay.
We're looking to expand that because as we've seen with the population growth, we're also getting, you know, we're an aging population. We see it all the time in the news that we're living longer.
Right.
So of course we're living longer. We're trying to live healthier longer as well, but still you're going to have those who are ill and who are going to need.
There will be issues popping up from time to time.
So the number of patients we had on our home care list 2 years ago, even 5 years ago, is drastically increased to what we have today. So we have staff who go out to meet those needs every week, and they're in contact with the family, in contact with the patient, And if they need to be seen by other services, we also make those referrals and make sure that the patient is seen holistically, so all their needs are met.
And I think that's the understanding of it, as we said before, that they're slowly and surely growing to meet the needs of the public. I mean, as we know that people are trying their best to extend their life. You know, you're eating healthier, you're working out, you're in the gym, you're doing things to extend your life, which will pay off, and we've seen it over the course of years. So that means that you also have to change the way how you deal with healthcare also.
Definitely. We have to plan not just for the average age expectancy, which at some point was 50 or 60. Now we have persons who are going into their 80s and 90s. So we have to be able to plan for them, because at the end of the day, your quality of life is the most important thing. It's not just to be alive. You want to be living.
Mm-hmm. You want that level of life that is comfortable.
Yes, and some form of independence where that's still an option. Because you don't want to just be taken care of or in a bed. We want to give that patient their independence, their dignity, their ability to help themselves and still feel like they're part of society and not a burden.
And that is so true, especially from the Caribbean standpoint. You know, we like to be, you know, the lone island. You know, like I've myself, days I'm walking around, I don't feel pain. I feel pain. And my daughter's like, Dad, why don't you go see the doctor? I'd be like, I don't want to sit down for an hour waiting for an hour. But now it's not like that. You can go in and see in a reasonable time. You know, you can go in and be taken care of.
Be seen, like I said, if you have a specific doctor, chances are you might not get to your preferred or specific doctor today, but you will get to another excellent doctor today, whether it be that there's an available appointment when you call GP clinic in Georgetown, or you go to the urgent care if that's a need that has to be met now and there's not any appointments. But either way, you'll be in good hands.
Perfect. And just wrapping up, want to thank you so much for stopping by today. The doors are always open here. Anytime there's anything going on in the GP clinic area and you want to stop by and let us know. Any final words you want to wrap up?
No, just thank you, Chuck, and thank you, audience, for having me today. It's actually been quite exciting.
Nice.
And I do look forward to being invited back.
So once again, folks, don't forget they are located on Smith Road. It's the new Georgetown General Practice and Public Health Clinic. It's on the second floor of the Smith Road Medical Center. It's open. They've been open from the beginning of this month, and they'll continue to be open there. Sometimes that you would want to stop by. If you want to just give me the times before we wrap up.
For the Georgetown GP Clinic?
Yes.
We open from 8 a.m. to 8 p.m., Monday to Friday, and on Saturdays only for the dressing clinic at present.
Okay, awesome. Thank you so much, Dr. Eryka. I appreciate you, and keep doing the great work that you're doing over the HSA.
Thank you, Chuck. Thank you, too.
All right, folks, thank you so much. We look forward to seeing you next week, as we say in the old days, same bat station, same bat channel. Keep right here. This is BoBo 89.1.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more